Having familiarized yourself with the first Psoas technique, let's review that so we can build upon it with the next set of techniques. The psoas muscles connect to 4 lumbar vertebrae and your femurs or leg bones and is commonly referred to as one of your hip flexors. It is responsible for approximately 60% of low back injuries. The AcuLever will utilize 4 different positions to treat the psoas muscle, the first just above the anterior superior iliac spine. You can locate the anterior superior iliac spine, or ASIS, in this image. It is the top plate of the ilium or hip bone. The AcuLever blades will slide right by these bones to connect to the psoas muscles. It is useful to locate the position of these bones by placing the outer ridge of the palm on top of them. Hold the AcuLever in your hands in this position to get a sense of where the AcuLever will insert into the abdomen. To begin the psoas technique, place the AcuLever on the floor or the table perpendicular to your body at 0 degrees. Lower yourself onto the AcuLever with the blades inserted in the correct position. From the side angle perspective, you can see a correct insertion of the AcuLever just above the ilium into the psoas. Reach back and ensure that the AcuLever is in the correct position. Bring your arms forward and lay flat with your hands underneath your chin. This is the first arm position technique. Begin rolling your body side to side to create the cross-fiber friction action into the psoas muscles. You can start slowly and pick up more speed as you become more comfortable in this position. Rolling your body side to side creates the maximum cross-fiber friction. You accomplish this by rolling your feet outward and inward at an ever-accelerating pace to ensure that the fin blades of the AcuLever penetrate deeply into the psoas muscles. To create a deeper technique, we will move to the second arm position. Raise yourself onto your forearms and press your hips into the AcuLever. Continue with the leg rolling motion as you press your hips deeply into the AcuLever. It is recommended that you spend some time in this position executing the cross-fiber rolling on your psoas to prepare for the third arm position. To execute the third arm position, lift yourself onto your hands while pressing your hips even deeper into the AcuLever. You may need to reposition your body slightly to ensure the deepest insertion of the tool. You can also use this type of repositioning to set the AcuLever into the second psoas muscle site. As previously mentioned, there are 4 psoas muscle sites for the AcuLever, 3 above the hip bones and 1 directly below the hip bones. To do a full psoas treatment, you will have to reposition the AcuLever to these 4 sites. To complete the psoas muscle routine, execute a tool-assisted stretch by bending the legs and bringing the feet towards the head. For the maximum tool-assisted stretch, you will need a partner. Have a partner gently push your feet further towards your head. Remember to breathe deeply and relax your body as best you can. This completes the psoas muscle routine instruction for the AcuLever.